Thank you very much, Dr. Walensky. I have the real pleasure to welcome and have a discussion with Dr. Lee Beers, who's a neighbor here in Washington, D.C., a pediatrician and a president of the American Academy of Pediatrics and a professor of pediatrics and the medical director for the community health and advocacy at Children's National Hospital. And our focus today is how we can increase COVID-19 vaccine uptake among a very important group, namely adolescents. To set the stage, let us look at some data on COVID-19 in children in the United States. So far, there have been more than 3.3 million COVID-19 cases and 314 deaths in people younger than 18 years of age, according to the CDC. The CDC recently published data on COVID-19 adolescent hospitalization rates. The rates, thankfully, were very low, about 2 per 100,000 at their peak. However, among hospitalized adolescents, nearly 1/3 required admission to an intensive care unit, and 5% required invasive mechanical ventilation. And about 30% of these children had no underlying conditions that were recognizable. You've all heard of the multisystem inflammatory syndrome in children, MIS-C. So far, there have been more than 4,000 cases reported to the CDC. And in a recent paper in the New England Journal of Medicine, reporting on MIS-C cases in 26 states, 73% had previously been healthy children. Long COVID has also been seen in adolescents and other younger patients. So I'm going to be talking to Dr. Beers and asking her about her experience in this regard. The bottom line is that COVID-19 in pediatric patients, although rare with regard to serious complications, definitely can be very serious. And the good news is that COVID-19 vaccine have proven to be very safe and effective, including in younger people. The Pfizer vaccine is already approved for people ages 12 and older. In a large clinical trial, that vaccine had 100% efficacy in adolescents 12 to 15. Similar results were reported with Moderna vaccine, who yesterday, June 10th, applied to the FDA for emergency use authorization for adolescents 12 to 17 years. And so we made some good progress in vaccinating adolescents. 23.4% for children aged 12 to 15, and 38.6% of children aged 16 to 17 years have received at least one dose of vaccine. The Biden administration has worked to improve adolescent vaccine uptake, such as with webinars and listening sessions, with pediatric education and other adolescent-focused associations following FDA authorization and ACIP recommendation. But clearly, more needs to be done. And actually, that's what we're going to talk about with Dr. Beers. So welcome, Dr. Beers. It's great to see you. It's great to be with you. It's a real pleasure. So let me ask you, as a pediatrician who talks with other pediatricians all over the country about their experience, what are the most compelling reasons for adolescents to get vaccinated? And in this regard, what have you seen with long COVID and other serious sequelae in adolescents?
Well, thank you so much for that. And really just echoing the thanks others have shared for your partnership and for the administration's partnership. We're really honored to be here with you today. And it's such an important question, and it's one that we hear a lot, right? And in my mind, there's really three key issues that compel me to recommend vaccine for adolescents. And in fact, given my own adolescents their vaccines, I have a 12 and 16-year-old at home. So, and I think three key things. First is that, as you just pointed out, vaccine, COVID infection in children and adolescents really is not benign. I think we've been very grateful that children don't seem to be impacted by the infectious complications of COVID to the same degree as adults, but they are still impacted and they can still get quite ill. And if we have a safe and effective vaccine to prevent that, we absolutely want to do that. I think the second reason is, the other impacts of COVID, the other impacts of the pandemic have really had a disproportionate impact on the children of our country. They've borne so much of this for us. Their school's been disrupted, their sports, their activities, their friendships, their social networks have been disrupted. And getting vaccinated is a really important way to get everyone back to that. There was a study released just today, actually, that there was an increase in suicidal attempts over the past year for young women, teenage women presenting to the emergency department. And so this is very real. And I think the third thing, and actually this is one of the things I hear from my kids and their friends, is that there's a sense of community obligation and service in getting the vaccine. I think our young people know that when they get vaccinated, they're helping to decrease the spread of COVID within the community, and that I think is a really important thing. And you also asked about long COVID, and I think you know this better than anybody. We don't, there's lots we still don't know about COVID. And when I talk to pediatricians across the country, you mentioned, I just have this great honor, and I really to be able to represent over 60,000 pediatricians across the country. And what I hear from them is that they are seeing kids in their practice every day, every week, who have had COVID and who are having lingering symptoms. And I think we're still getting our arms around the data on that. But what I'm hearing from pediatricians across the country is that's a very real thing, and that kids are having prolonged symptoms. And just one more reminder how important it is to really be protecting our young people and vaccinating them with the safe and effective vaccine as it's available.
Well, thank you for that really, really wonderful answer. I'm very impressed by the aspect, Dr. Beers, that we talk about a lot. And it's good to hear from you about your children, your two teenagers, about their appreciation for the community responsibility. Because, we talk to them about the fact that indeed, as I've mentioned, children can get seriously ill, even though the incidence of that occurring compared to the elderly, for example, is much less. It still can be serious, but the idea that your children realize the communal importance of it. So how did that conversation go? Just to give people an idea, did they come to you and say, Mom, we'd like to get vaccinated? Did you nudge them a little bit and say, by the way, should you get vaccinated? How does the conversation go? I've had 3 teenage girls a long time ago. They're no longer teenage. And I'm kind of wondering how that would go today if they were teenagers. So how did the conversation start?
Well, that's a good question. My kids may be in a unique situation, so maybe I'll tell you about my kids and then also what their friends are saying too. My husband is also a pediatrician, and with this role and work from home, I think my kids have overheard more about COVID and the COVID vaccine than probably most adolescents their age. So I think they started with a good baseline knowledge, but I will tell you, they came to me. It actually started. Well, I would say it started with a conversation even before the vaccine was available to any of us. And my 16-year-old said, Mom, are there any vaccine trials near us? I'd like to be in a vaccine trial. And so that led to some additional conversations. And they both, when the vaccine was available, they said, when can you sign us up? My son is 12, and so he was more recently available, and he's been counting the days until the day he's fully vaccinated. So I think they're really enthusiastic about it. But when I talk to my patients or to friends or others who have kids who aren't growing up in a household where we're talking about this all the time, I think a lot of it is about getting back to the things they used to do, getting back to full in-person school and getting back to sports and being with your friends. And lots of the questions my daughter asks are, okay, Mom, can we go to a movie theater now? Can we take, can I go on the metro? Can we, so a lot of it is really about getting back to the things that they love to do and that they want to do without worry and without hesitation.
Terrific. Well, let's go to the other side of that coin, Dr. Beers, and that has to do with vaccine hesitancy. One of the things that we are concerned about, obviously, is that there is a degree of vaccine hesitancy that we have to address. And in interactions with patients and their families that you have, do you often encounter vaccine hesitancy? And what are some of the concerns that parents and maybe even the children have, for example, in your clinic and in your practice? Could you tell us a little bit about that?
Yeah, absolutely. And I think, you're very right. And just as with adults, adolescents have vaccine hesitancy and parents have vaccine hesitancy for their kids. And I think, there's a couple different groups, I would say almost. There are parents and teens who just have questions that they need to have answered. They're sort of on the fence and they think they might want to do it, but they're not sure. They've heard just conflicting information and they want the opportunity to ask some questions. And I think those are some of the panelists earlier talked about how just having those conversations in your practice are so important to really reaching families who may just have a few questions. I think there are other families who have more specific questions. I think some of the most common things I hear are concerns about, how the speed of which the vaccine became available or whether or not we have enough experience with it in kids. And I think, those are things we're able to talk through and again, answer those questions very honestly and transparently. And I think the general public knows more about the vaccine development process than ever before in probably any of our lifetimes. And then I think there's this whole other bucket of misinformation. And that in some ways, sometimes that's easier to deal with, sometimes that's harder, right? And so I think, some of the misinformation that's out there about, vaccines causing infertility or other things that we just know aren't true. And so really, again, I think maybe it was Dr. Jones earlier said, I just ask patients, what are their questions? What have they heard? And so asking about those things and then talking through why we're not worried about those things without, of course, reinforcing the misinformation. We have to be careful to do that too. And I think, unfortunately, social media is powerful and there's a lot of misinformation on social media and our adolescents are on social media a whole lot. And so they see the good stuff, but they also see the misinformation there.
Great. So I have time for one last question that I have to ask you. Since you are the president of the American Academy of Pediatrics, could you just tell us what are some of the initiatives that the AAP and Children's Hospital are involved in?
Thank you for that. I would love to. I think vaccines in general is something that pediatricians have been doing for a long time, and so we thought about this a lot. And when the COVID vaccine came up and came available for adolescents, we were really ready to jump in. So I would say a couple things that I'd love to highlight. The American Academy of Pediatrics has a campaign called "Call Your Pediatrician" for parents. We've got fun PSAs and social media tags and articles on our healthychildren.org website that you can push out and really encourage parents to call their pediatricians, both for questions about the COVID vaccine, but also, get back in for your well visit and get caught up on your other routine immunizations as well. Some of the things I'd love to highlight and our work at Children's National, actually a really terrific partnership that we had with DC Public Schools. And we partnered together with DC Public Schools actually before the vaccine was authorized in adolescents, because we really wanted to make sure the teachers were vaccinated and felt comfortable going back to school. And so we partnered with them, went down to Dunbar High School here in DC and had a couple really big days where we brought teachers in to help them get immunized. And I tell you, it was just just, I was down there, lots of my colleagues were down there, and it was just one of the most joyful things that we had done all year. And it was really, really a special opportunity.
Terrific, terrific, wonderful. Well, one of the things that we talk about a lot in our medical response team, particularly among the community core concept, is trusted messengers. And without a doubt, your physician, your family physician is a trusted messenger. And among those, clearly pediatricians rank very high among them. So keep up your great work. We really do need what you all are doing. So thank you very much, Dr. Beers. It's a real pleasure speaking with you. And now let me just turn it over now to Dr. Marcela Nunez-Smith.